Everyone, good afternoon. Welcome to the American Rescue Plan, an overview of the opportunities to access resources for violence prevention, trauma recovery, reentry, and community development. We're going to give folks a little bit more time to join, so just get comfy and thank you for joining us. We're approaching critical mass. One more minute before we get started. All right, folks. So thank you. Welcome. Welcome to the nearly 700 of you who have registered for the American Rescue Plan and Overview of Opportunities to Access Resources for Violence Prevention, Trauma Recovery, Reentry, and Community Development. This forum is sponsored by the National Coalition for Shared Safety and made possible in part by a generous grant from the Joyce Foundation. I'm Shakira Diaz. I am the Chief of Staff for the Alliance for Safety and Justice, the founding organization of the coalition. Let me give us an opportunity to just kind of go over some logistics. Everyone who registered will receive or has already received a 4-page overview of the opportunities that we're going to be going over today. We want to make sure that this would be interactive and that we would provide you some information in writing that you can look at your leisure. So you will have that. If you do not already have that, we're going to make sure that we drop it into the link. So be mindful of that. Throughout today's forum, if you have a question, please use this Zoom question function during the forum. We're going to try our best to make sure that we're integrating all of your questions and comments into our discussion today. We are also recording today's events, which means that you have the opportunity, if you've registered, to kind of see it again at your leisure, so you're able to process the information. Before I turn things over to our presentation, our panel discussion, I want to take a little bit of time to just kind of give you some background about the vision of today's program of shared safety. Some of you, this may be your first time joining us for one of these events, so I just want to give you some background information. We've been in this pandemic for nearly a year now, and when we started this new way of living, my colleagues and I at the Alliance for Safety and Justice, we were concerned. We were concerned for not only ourselves, but also our communities. We work across the country. We're a multi-state organization. And we were particularly concerned about the communities with the highest, we work in the communities who have the highest need and who are traditionally underserved. So we were very well aware that those folks who live in those communities are going to be highly impacted. ASJ is an organization that is primarily staffed by impacted people. We were worried for a number of different reasons, but primarily, these communities are our communities. They are the communities that raised us. They are the communities that we live in. So we are very well in tune to the gaps that existed before, and particularly concerned about the widening of gaps that would happen as a result of this pandemic. We knew from work and personal experience that the country was locking down and that the economy was going to start contracting. The communities that were already in crisis were going to be hit especially hard, which is typical, and we were aware of that. That's why the Alliance for Safety and Justice has worked to promote safety as well as transformative reform through state-based advocacy. We knew that we had to find a way to lift up and scale national and federal level advocacy, which we call shared safety. So some of you may be wondering, like, what does shared safety mean, right? Shared safety for us means that for us, shared safety is an answer of what should replace mass incarceration and criminalization. It's a policy framework that centers public safety, well-being, survivors, breaking the cycle of harm to making our systems work for us, making our system work towards safety. As we began to think about how we could bring this perspective to the national level, we focus on the providers who embody shared safety. We talk to violence prevention organizations, we talk to victim services and trauma recovery programs and professionals. We talk to reentry providers. We talk to organizations dedicated to community-based economic development. And from those conversations, we established the National Coalition for Shared Safety. We formed the coalition because we saw a gap in federal advocacy. While there's a lot of really important work going on at the national level, we didn't see any group making the case for the programs that communities need to feel safe, right? Particularly in a moment like this. And that's the value that we hope to add to the federal and national advocacy work that we're lifting up. We want to be the nation's safety solution, safety lobby, right? Our coalition has not been around for a full year, but we've had some really important achievements that we want to be able to share with you. For example, we sponsored the Toward Shared Safety, the first ever national survey of safety gaps in the country. It's a report that polled folks from all around the country. The survey demonstrated remarkable consensus. It found that large majorities agree that public investments should prioritize violence prevention, recovery, mental health, reentry, and the most effective strategies to stop the cycle of crime more than incarceration. Our work has helped move CARES Act funds to community-based critical assistance providers, organizations, and provide services like violence prevention, victim services, reentry support. Abby, could you cue the stories from the work that we've done? So this is an example of how our advocacy as a coalition at the national level, led by the Alliance for Safety and Justice, has resulted in federal investments in local communities hardest hit by crime, who traditionally go underserved. So for more on this, in Illinois, the Alliance for Safety and Justice organized a state-based coalition for shared safety and worked with our legislative champions and the Attorney General to ensure that almost 20 million of Bureau of Justice Assistance funds went to organizations and communities that were most impacted by COVID-19. The CARES Act provided important relief to millions of people, but it did not make the kind of intentional investments in safety that communities in crisis need. Where the CARES Act fell short, we believe that the American Rescue Plan can provide relief and rescue resources for communities needed right now. To explain how we can realize the promise of the American Rescue Plan, which is in many ways very historic, I want to turn it over to my colleague from the Alliance for Safety and Justice, John Mackey. Kicking it over to you, John.
Awesome. Am I on here? All right. I'm not sure I'm spotlight. Here we are. Okay. Thanks, Shakira. Thank you so much. Good afternoon, everyone. My name is John Mackey. I am the Director of Innovations at the Alliance for Safety and Justice. And I want to provide everyone a broad overview of the funding opportunities in the ARP, the American Rescue Plan, and outline some advocacy strategies to access them. Before I do this, let me just state in simple terms what makes the ARP important and unique compared to not just normal federal funding, but also even recent stimulus acts. So to put it in simple terms, the American Rescue Plan presents an unprecedented opportunity to transform our country's response to violence and unaddressed trauma. The ARP has the power to move us away from our expensive and harmful over-reliance on criminal justice, and it can help us build more effective systems grounded in prevention, public health, and shared safety. Now, the reason the ARP can do this is because it's different from other stimulus acts, particularly when it came to public safety, the CARES Act, and the 2009 American Recovery and Reinvestment Act primarily relied on established grant programs and also invested billions of dollars in local, state, and federal criminal justice systems. Now, what makes the ARP unique is essentially two things. One, the ARP relies on a public health approach to address the harms caused by the pandemic, giving discretion to government agencies to create programs and responses along these lines. And second, it contains no mandated investments in the criminal justice system or in criminal justice programs. So this second thing is really extraordinary. And to give you an idea of how different the ARP is from other stimulus acts, the ARP doesn't even contain the words criminal justice. It doesn't even contain the words law enforcement. And this is so extraordinary. I kept looking, and maybe I have, I kept thinking there was a part of the bill I was missing because these kinds of investments are so typical of government spending. So for the people and organizations that work in community-based violence prevention, trauma recovery, mental health, reentry support, we simply have never seen an opportunity like this, and certainly at this kind of scale. But to make sure that the ARP is going to deliver on its promise, this is going to require some important and urgent actions. So first, most importantly, this is going to require bold leadership within federal, state, and local government agencies as they're translating ARP's mandate into policies, program, and into funding opportunities. So this is really important here. Basically, all of the opportunities that we're talking about today, they are all going to depend upon how the streams of money are interpreted and administered. Okay, so while the ARP does not make any mandated investments or the kind of the typical investments you'll see in government spending, without our advocacy, governments will certainly make these investments, right? Criminal justice is just one of the ways in which government spends money. So for us to do this work, there's going to be some really strong advocacy that's required. And I want to propose a cycle of advocacy with various stages. Let me find my place in my notes. Okay, so first stage. So from now until at least the Biden administration starts to release funding opportunities and the guidance around the ARP, at the federal level, I recommend that we all need to speak with one voice to President Biden. As the federal agencies are crafting solicitations and guidance for the ARP funds, we need to ask President Biden in particular that they provide maximum guidance and maximum flexibility so that the ARP funds get to the kinds of programs and organizations that are closest to the harms caused by the pandemic. Now, by maximum guidance, what I mean here is that as federal agencies are crafting their guidance, they should explicitly prioritize organizations that are based in and staffed by the residents of the communities they serve and have an established history of providing effective safety solutions. By maximum flexibility, I mean that federal agencies should do all they can, all that is practically possible to accelerate bureaucratic processes, and really importantly, to remove the kinds of barriers that often prevent providers from accessing federal resources. So to make sure that President Biden hears this message, the National Coalition for Shared Safety has drafted a letter that we're asking everyone on this call or everyone on this meeting today to review and sign. So I see my colleague Brian Kenner has dropped in the chat. Please look at this as soon as possible and sign it. The letter, along with the overview, along with this webinar, will also go out shortly. So second stage of advocacy. From now and probably through at least the end of the summer, if not longer, we need to make sure that the state and local agencies and government leaders who are responsible for these funds hear the same kind of a message. So early next week, we will be issuing a short report on the American Rescue Plan. It's going to provide resources, language that you can use to advocate for these funds in your state, in your city. Okay, in the last stage, and this will kind of then circle back, as these funds are being dispersed throughout the country, we need to build the capacity to watch over their implementation. This is often a gap in advocacy. We often will kind of advocate really hard for something and then kind of walk away or look away when we turn it on, it doesn't quite work the way it's supposed to. So we can't make that mistake here. So this implementation needs to happen at both the national level, but probably more importantly at the state and local level. And as the implementation work unfolds, please look to the National Coalition for Shared Safety, my organization, the Alliance for Safety and Justice, to continue to provide resources, capacity along those lines. So now let me go to the next slide here, and I want to just kind of briefly walk through 5 of the funding opportunities that we see in the American Rescue Plan. And again, if you want to follow along, my colleague Brian Kenner put a link into the chat that kind of gives an overview of the funds, along with some kind of advocacy advice. So the first fund I want to talk about is the Coronavirus State and Local Fiscal Recovery Fund. This is in section 9901 of the bill. This is by far the biggest part. It's going to give billions and billions of dollars to governors, mayors, county board executives. And what's important to note here is that the doors or the kind of elements are kind of ways to get funding are very broad. So there's going to be a lot of competition. And so it's going to be important, and we'll kind of come back to this over and over again. It's going to be important that if you're going to go after these funds, that you really hook onto the criteria of funding. So the first criteria is to respond to the public health emergency with respect to the coronavirus. In my mind, this, a really good hook here is the documented spikes in violent crime that have been exacerbated by the pandemic. So I think anyone who works in that space has a very, very strong hook as a way of responding to the public health emergency. A second hook here is the negative impacts that the COVID pandemic has. That has the negative impacts that have been brought by the pandemic, including assistance to nonprofits. And by the way, these are quotes from the bill, so this is language that you can use. So one of the most inspiring things about the pandemic is how many community-based organizations went above and beyond the work they normally do. Delivering food, mediating conflicts. So as organizations have done more with less, I think you have a very strong argument to say that you've been negatively economically impacted by the pandemic, and you deserve some of this funding. One more hook to kind of emphasize is that there's a way to pay for essential workers. So many states, many cities have declared providers like victim services, violence prevention essential. And so if that's the case, I think you have a strong argument to say that you should get funding under that hook. The second element I want to talk about, so go to the next slide here, is $49.5 million that's been set aside for Health and Human Services for underserved survivors of domestic violence and sexual assault. What's really important about this fund, and none of these funds have come out yet, at least as far as I've checked. So if you're watching for these funds at the Health and Human Services, but this is money that is in addition to funding for more established programs. There's already funding for traditional or kind of more established programs for domestic violence, sexual assault. This is funding to provide, tracks of funding for underserved victims of domestic violence and sexual assault. So if you're an organization that provides services to communities of color, for example, who are historically have real difficulty accessing services, this is funding for you. Second funds I want to talk about, $47.8 million to the Secretary of Health and Human Services to help stop the spread of COVID. This fund's going to do a lot of work, but one of the things that's doing is supporting related strategies to stop the spread and giving grants to local and state health departments. As jails and prisons have been one of the country's worst hotspots, I think there's a strong argument to use these funds to keep people out of jail and prison. Next funding stream, $50 million to the Secretary of Health and Human Services to address behavioral health needs that have been exacerbated or caused by the pandemic. Very strong research supports that violence comes out of behavioral health issues, and this funding stream has all kinds of ways to get funding to do things like promote care coordination, really important, to train. I know training is a big issue, especially even getting access to funding. So this is money for training, and also to expand evidence-based models of care. So this is funding that will come out of HHS that are for those kinds of needs. Lastly, I want to talk about a change in Medicaid, which I think in many ways is the most exciting thing in this bill. So this is, first of all, there's going to be $50 million of planning grants to help states change or amend their Medicaid plan to create community-based mobile crisis intervention services. And basically, and we'll talk about more about later in this forum, these are services to create wraparound services for people experiencing a mental health or substance abuse crisis outside of jail, outside of prison, outside of a hospital. Really, really exciting. So I now want to get to our panelists to talk about, all subject matter experts, to talk about how to advocate for these funds and position organizations to access them. But to frame this discussion, sorry, really quick, to frame this discussion, I want to talk about a lesson I've learned about federal funding. So before I came to ASJ, I was the executive director of a state agency in Illinois that administered DOJ pass-through grants, JAG, VOCA, VAWA. And I want to highlight this experience, not because it means that someone like me has some kind of special mastery or knowledge of federal grants, but rather because I think my experience provides an important perspective that can help demystify federal funding. When we look at federal funds, we often see the same programs and approaches getting funding over and over again. And it's easy to assume that this is simply the intent of government, that government is protecting itself by supporting the status quo. And there's certainly some truth to that. But there's also another reason, and actually two reasons that I think are really important here. So when I look back on my own experience or think about work I've done across the country, I think oftentimes the most powerful obstacles to innovation with federal funds are ignorance and fear. So in my experience, I came to government, I wanted to do big things. And while I tried to know as much as I could about federal grants, I was always worried I didn't know enough. And this made me feel afraid. I think this is the experience of a lot of administrators. Federal funds are big, they're scary, they come with audits attached to them that are different than state audits. And this fear that is born out of a feeling of ignorance can lead people to rely on past practices. So I knew in my position, right, I knew if I anchored what I did in what came before, I couldn't get in trouble. So I think this experience and dynamic is actually what ends up driving a lot of federal funding. And in this case, we can't let the usual ignorance and fear that too often attends federal funds to stand in the way of realizing the opportunity in the American Rescue Plan. So I think, as we'll talk about with our panelists, the key to overcoming these obstacles is to ground advocacy in the state's statutory purpose, and then to execute campaigns directed at the officials who are administering these funds to educate them on the purposes. And so that's what we'll talk about right now. So let me first bring on Akil Shrills.
Hi.
Hey, so Akil, as I just noted, the ARP allocates funds to state and local governments to mitigate and respond to the public health crisis of COVID. These funds, as I noted, will have lots of competition, so we've got to really ground them in the purposes of the fund. Akila Shrills, you are a national violence reduction expert. You're the head of the Newark Community Street Team, a trauma-informed evidence-based violence reduction program, co-founded by Newark Mayor Ross Baraka. Based on the work you do in Newark and have done throughout the country, can you talk about why organizations like yours should receive state and local fiscal relief?
Thanks so much, John, for laying all of this important information out, just in terms of, the American Rescue Plan. This is significant for community-based organizations who are working on the ground in cities across the country who have been impacted by COVID, right? As John said, the Newark Community Street Team was launched by the mayor in 2014 as a part of his coordinated strategy in the city to reduce violence and crime in Newark. Some of you guys might know that Newark was on the top 10 most violent city list for almost 50 consecutive years. But with the mayor coming in and his innovation and genius, he was able to pull together law enforcement, health, faith, community-based organizations to coordinate their strategies around reducing violence and crime in the city. And so in 2020, as we saw the impact of violence, spike in multiple cities all across the country, including the state of New Jersey, right? We had a 19% spike in homicide shootings, in addition to an 18% spike in domestic violence. And, there was a lot of animosity, because this was, also centered around the public execution of George Floyd. Sometimes when violence happens in other cities, I mean, that happened in Minneapolis, but it also impacts people's relationship to law enforcement in the state of New Jersey, right? And in the city of Newark. It impacts, people's their ability to do investigations and everything, right? And so it became extremely important that, that as the pandemic began to roll on, that the mayor identified the Newark Community Street Team as essential workers, right? And again, this was community-based, community folks who were trained as public safety professionals to stand on the front line in terms of delivering PPEs, food, literature and information to residents in the neighborhood to help them kind of deal with the impact of the pandemic. And so, although we saw major violence spike all across the state and all across the country, in the city of Newark because of this coordinated strategy, and I would say with Newark Community Street Team as one of the central programs in terms of reducing violence and crime, Newark had 51 murders. Now, again, it's 51 murders too many, but in 2019, we had 51 murders in the city. I mean, we cut the murder rate in half over the past 5 years because of our coordinated strategy. And again, even though violence spiked all across the state, because of our coordinated strategy, because of community-based organizations on the ground, and the mayor deeming our workers essential workers from the very beginning, it put us in a very powerful position to keep violence, down in the city, right? I also want to give a big shout out to our partners in philanthropy, because they honestly came in and helped to really ease the burden, that the most vulnerable in the community was experiencing. Foundations like Prudential and Victoria Foundation and Healthcare Foundation for New Jersey, AT&T and Open Philanthropy, they all came in at a significant time, for NCST, because as violence was spiking across the city, that strategic investment that came in helped us to hire more staff, to deploy them in key areas of the city where violence was happening, to be able to prevent retaliatory homicides, as well as to step into situations where domestic violence situations were happening. But understand that the philanthropic investment was a one-time investment. And so now we're looking at the federal government and looking at the ARP as an opportunity to be able to take out the philanthropic investment and put in long-term, like sustainable resources, to support this coordinated strategy that has brought violence to an all-time low in the city of Newark, right?
So Akilah, we're almost at time here in yours. And I think just to kind of begin to wrap up, what's really important here is I'm hearing from your account, you've, one, the violence that have come out, that you've worked on as part of the pandemic, that you had a negative economic impact because of the more work you were doing, right? And that in your city, you were declared essential worker.
Absolutely. We were deemed essential workers from the very beginning. We watched the violence begin to spike in the city of New York, with law enforcement being on the front end of actually enforcing sheltering in place and people wearing PPEs, and so the mayor recognized that wasn't probably the best strategy. That it was probably better if we deputized the community-based public safety professionals as essential workers and rolled them out as the first line of defense in the community. So we set up this COVID information and education task force, in which the community-based organizations, we were the front line of defense in the community in terms of talking with residents, sharing with them information, because of course the pandemic impacted Black Americans and Latinos more than any other population in the state, and so we were able to get to folks and to utilize our relationships and ask people to stay in the house just a little longer while we do some of the challenges.
Yeah, no, that's amazing work. And I know, a lot of work like this done all across the country. And what's so important here is that work fits into this fiscal recovery. So thank you so much, Akilah. I want to move to the next funding stream. So as I noted in my overview, there was $50 million for HHS, and I'm going to quote here, to support culturally specific relief for survivors of sexual assault and domestic violence. I'm going to bring on Brenda Glass. Brenda, you are the head of the Brenda Glass Trauma Recovery Center in Cleveland, Ohio. Can you talk about how a program like yours is built to help meet the needs of survivors that more established programs fail to reach?
Hi, John. Thank you so much for inviting me. Thank you, Shakira. This is a very important topic for me because for years I have been in the community seeking to serve individuals who are less likely to get help. So back in 2003, it was really imperative that my services were offered, but it was offered in a faith-based environment. We learned a lot during that time. So right now, we're looking at something that's really a big phenomenon in our community with the onset of COVID-19 and the pandemic. We know that everybody's reporting a spike in crime throughout every state. In the city of Cleveland, we have had an increase in domestic violence. Domestic violence shelters have been overrun, overcrowded. They lack the capacity to serve people during that time. But the Brenda Glass Trauma Center was there with boots on the ground, as Akila said. You know, we never went home. We stayed out in the community, serving individuals face to face, meeting them at point of impact in hospitals, being able to get them to a safe place. You know, with the spike of with domestic violence, we've seen 44% of the people that were murdered out of the 176 that were murdered in 2020 were women. And it was due to interpersonal assaults, you know, from intimate partners. We also know that a lot of those women would never have sought victim of crime services, nor would they have gone to domestic violence shelters. The majority of the people that are African American or Hispanic that show at emergency rooms for trauma or victimization rarely seek any services after that physical assault. But what we do know, and what I learned back in 2003 when I started this work, was that people become injured from many aspects of their lives. When I am attacked both physically, emotionally, spiritually, and environmentally. But healing rarely takes place in our services as usual in all four areas of a person's life. Trauma centers are designed to do just that. We are designed to work with people from every aspect of their injury. We provide spiritual healing. We provide psychotherapy. Psychotherapy is something that's really frowned upon in our people of color communities because we have a tendency to not trust those environments. We've been through a lot of history of being over-medicated and underdiagnosed. So what that means is that there's a lot of research out there that shows that African Americans are mostly diagnosed with schizophrenia or bipolar as opposed to post-traumatic or either depression or anxiety. And so they're fearful. There's a lot of fear involved in seeking services from traditional agencies or traditional medicine, right? So what we do is we break the barrier. We help people to understand mental health. We help them to understand that there's not a stigma attached to mental health. There's actually a healing and acknowledging where your illness is. We don't look at mental health like we look at medical health. We encourage people to take care of diabetes and high blood pressure. But when we start talking about mental health, we stigmatize it and make it something wrong with us as opposed to something we're doing that's right for us. So we seek to tear down those barriers as well. In our work with our clients, we help them to really, we put them on the same level as we are on education-wise, right? We don't have a hierarchy of care where I'm the all-knowing person and you're the one that's in need of help. We educate our clients to help them to understand all about mental health. We help them to know where mental health was derived from. We help them to understand the tools that we use, that we give to each other. The people that we serve are people just like us. So therefore, there is no sense of where you can't understand what I've gone through because you'll know from the beginning, we are all victims of crime. Most African Americans were born into some sort of trauma. We're born into poverty. We're born into believing that we are less than, that we can never be greater than. We're born into believing that society will never look upon us as a favorable entity of that community. And so what we do is we help people to understand, we see where you are, we know where you're coming from, but we want to make our services specific to your needs. Help me to understand you. Help me to see what your needs are. We also know that because we've been victimized ourselves, you know, through domestic violence, gun violence, we've lost our loved ones to the street violence that goes on in our communities. So when people can recognize that you really buy into them, then they buy into your services. We've seen that with our services that everybody is not ready for domestic violence shelters where hundreds of people are housed or multiple families live and we have to coexist in the same communal area, right? Some people are not ready for that. So trauma recovery centers target those individuals as well. We get them to a safe place and we have our own safe shelter in our trauma recovery center. Only one family is in a house. Only other two same-sex individuals will go in a house. That gives people a sense of normalcy, and it also gives them the desire and a positive thinking base where they can decide they can do better than what they came from. Sometimes we have that mentality in typical services that we don't want them to get too comfortable or they might want to stay there. But what we've seen is that the more comfortable they get, the more they want to keep that comfortability and they want to live in their own place and on their own. We're able to connect them with employment. We're able to link with landlords in the communities who's willing to give our clients a chance to actually rebuild their lives, start a new life for themselves. And so we move people faster through homelessness into permanent housing through this type of services than we would do with a typical domestic violence shelter or homeless shelter. Within 3 months to maybe at the most 6 months, depending on the injury of the individual, they're permanently housed.
So Brenda, yeah, I'm sorry. So everyone, amazing job. Everyone here who runs a program, who knows a program, that kind of identify with Mrs. Glass, like how she described her program, what she's doing. This is funding for you. This is funding, at least in my experience in federal funding, I've never seen open before. Yeah. So thank you, Brenda, so much for laying out the case for why this funding is so important and why we should all be looking for the solicitations to come down to fund programs just like yours.
Yes.
Great.
That
so
is
the
so
next,
true.
Excellent. So top of the next funding opportunity, as I noted in my presentation, there is $47.8 million at HHS to, among other things, support related strategies and activities to mitigate the spread of COVID. So again, we know that jails and prisons are two of the country's worst COVID hotspots. This creates really a great argument to use this funding to do deflection, diversion, reentry work. I'm going to bring on Susan Burton, the founder and the head of A New Way of Life, talk about her program. But before we do, I want to play a short video about her work. So it doesn't appear the sound is working, which I apologize for. I don't know if other folks are not hearing it. So on the back end here, yeah, apologize. Always going to have some kerfuffle with Zoom. Let me just say it's a beautiful video. Should all go. Oh, here it goes.
Of A New Way of Life Reentry Project. The problem I'm addressing is the mass incarceration of women. Women are the fastest growing segment of the criminal justice system, and 1.9 million women come home each year across the United States. A New Way of Life provides housing, case management, reunification services, job placements, training opportunities, and I'm proposing that we expand A New Way of Life Reentry Project across the entire United States. The project is called SAFE, Sisterhood Alliance for Freedom and Equality. Success will be measured by the number of women that we serve, the number of hubs that we put up, the number of children that are reunited with their parents, the number of people that get jobs, and the number that do not recidivate. What we have here is a solution to a national crisis that we will reallocate resources back to the community, reduce the prison population, allow our communities and our families to heal. If we're going to end mass incarceration, we must address women, and we especially must address the reentry of Black women. We want to take SAFE all over the nation. This is a solution that is working.
Thank you so much. Let me get myself on the screen along with Ms. Burton. All right, so wonderful. So Ms. Burton, can you talk about why programs like yours should be funded as a related strategy to stop the spread of COVID?
Yes, so a new way of life was created as a way to support reentry services and to create health and safety for communities and people that were coming back into the community. When the pandemic hit, we know that jails and prisons were a hotbed for the spread of COVID-19. And what we did at A New Way of Life was to immediately look at how we could expand our services to get people released out of incarceration back into the community, that allowed them to shelter in place, allowed them to have some safety, and allowed them to be housed during that period. I can only imagine what it would feel like and be like, and what it is like to be in a prison cell, a dorm with people who are infected with COVID, and you have no way to actually prevent yourself from being infected. So all across this nation, prisons were where people were dying, people were getting COVID, and they were just unprepared for this disaster of COVID-19. I think our whole nation was prepared, but our penal system was really underprepared. So places like A New Way of Life and the ability to have programs for housing programs where people can leave incarceration, come back into the community during a pandemic, but not only during a pandemic, but throughout for all releases. We have, as a nation, overinvested in incarceration and underinvested in communities that's been hit really hard by incarceration. During the war on drugs, the rate of incarceration for women just rose exponentially. And we have 1.9 million women released from incarceration each year. And I'm not even talking about the men and the children, that's just women. So programs like A New Way of Life could be and should be invested in and expanded across the nation. So I, like Shakia, want to acknowledge the individuals and the foundations that during this time have came forward and invested and supported the work of organizations like A New Way of Life, like the New Work organization that stops violence, like other organizations, but their investment was just for a time. With the American Rescue Plan resources, they should be made available to us. I'm going to be advocating. I'm going to be working with our County Board of Supervisors, with our state legislature, and with our federal senators and congresspeople to ensure that we're able to continue the progress that we've made through the pandemic into the future and be able to sustain it. What we do is this shared safety concept is crime prevention, violence prevention, and it enhances the health of our communities. We know this, we do it, it's proven, it's documented. So I'm looking forward, John, and with Alliance for Safety and Justice. We've done work with you over the years, and we've won. We've won, and we've won big. And I'm going to look forward to continuing to work with you locally and with the National Coalition for Shared Safety to work nationally. The model of a new way of life is now in 14 different states, but we want to build centers of excellence that trains those communities to expand those services, those supports throughout the country. So I just want to thank you and Shakia right now for allowing us this time to talk about our solutions to safety that we're bringing about in this nation. Thank you.
That's amazing. Thank you so much, Ms. Burton, and the work you do, and just really a compelling case for why programs like yours is a powerful way not just to simply stop the spread of COVID, but to produce better outcomes in communities throughout this country. So again, in my presentation, we talked about $50 million that has been allocated to HHS to address the behavioral health needs caused by the pandemic. I'm going to bring on Dr. Kyle Fisher. Dr. Fisher, you are the policy director for the HAVI, the Hospital Alliance for Violence Intervention. Based on the work that you've done all across the country, coordinating, developing, and advocating for evidence-informed policy to end community violence, how do you see, or how can the $50 million from HHS support the kinds of programs that the HAVI works with?
Thank you, John. I really appreciate it. And I just want to thank everyone before me for really building this up. And I hear so many commonalities between all of what we do. Just very briefly, the HAVI, the Health Alliance for Violence Intervention, we have about 40 member programs across the country, as well as another 40 or so emerging hospital-based violence intervention programs. And our programs are really an integrated, comprehensive, health-based model that cares for victims of violent injury. And we believe, and the research shows, that violence is a public health issue that requires public health solutions, which is why this particular funding stream is so important, because implicit in this is this idea that violence is a health issue rather than a criminal justice issue. And, you know, sadly and tragically, I think this pandemic has given us another proof points to what we all on this call probably already know. Even before the pandemic hit, Black and Brown communities across the country had been hit very, very hard with endemic gun violence. And then as the pandemic came along, tragically, those same communities are the identical places where COVID-19 has really came across the hardest. So if the violence goes up in the same place where the pandemic goes up, I don't know what, you know, public health looks like with my plain eyes other than that. And that's why I think it's really, really critical that we talk about this advocacy and opportunities in this rescue plan through this lens of racial justice. You know, when you look at federal grants and things, they will have code words like disadvantaged populations and things like that. And that's something too that we can use as a point to advocate for our communities and the people that need the help the most, to make sure that they get the resources that they need. So how does that relate to our work at the HAVI? Well, so hospital-based violence intervention programs, we are team-based approaches to care, and we engage survivors of violence to help care for them in the hospital, in the community, and for months, if not years afterwards. And the primary drivers of these teams are folks that we call violence prevention professionals, who are from the communities that they are caring from. Frequently, they are survivors of violence themselves and are especially trained to help care for their own communities. So why is this a behavioral health issue, and why do we have a case to make to the Department of Health and Human Services? Well, I think many of the panelists before me, Akila and Ms. Glass and Ms. Burton, have already talked about the profound influence of trauma as driving much of the violence in our communities. We have communities and individuals that have experienced violence, they've seen violence after they've been injured. We know from research that that is one of the biggest risk factors for being injured again. And we know that if you have been a victim of gunshot injuries, that post-traumatic stress disorder and traumatic stress isn't a rare occurrence. In fact, it's the normal. And human beings being human beings, we tend to self-treat with things like alcohol or cannabis or other drugs, or we start carrying a weapon to feel safer. These are all normal human being things to do to regain that sense of safety and to deal with trauma. And this all fits into this idea that violence fits under the Health and Human Services model of public health and behavioral health needs. And it's a very easy pitch to make that this already fits into what HHS has already said they're willing to support. And in fact, we're not breaking any new ground here. The Department of Health and Human Services already supports through some of their agencies existing funding streams that we can name and say through SAMHSA, the Substance Abuse and Mental Health Service Agency, you have the RECAST grant, which stands for Resiliency in Communities After Stress and Trauma, and you've already funded this work. So let's use this $50 million, and it's nothing new. Let's use it for these public health solutions that we know work. So I'm sorry, John, if that kind of goes against your point before of trying to push them to do new things. But on the other hand, if there are already things that federal funders are already comfortable with and knowing with, and we're doing things that fit into that framework, well, that's an easy sell as well.
Absolutely. Dr. Fisher, thank you so much. Just laying out the case for why, programs like yours, programs that work with communities in crisis, really demand and need and have received and should continue to see these kinds of behavioral health needs or these kind of behavioral health funds. Okay, so I next want to go to, again, a really important change in Medicaid that the American Rescue Plan makes. Kritika Harish, you're a policy expert that works with Inseparable, a new mental health advocacy organization. Can you talk about this new change to Medicaid and what it could mean for states, especially expansion states that are looking to create community-based services for people?
Sure. Thanks, John, and thanks, Shakira, and thanks to all the speakers who came before me. As John mentioned, I'm here on behalf of Inseparable. We're a new mental health advocacy organization, and we're called Inseparable to reflect a simple truth. The health of our bodies cannot be separated from the health of our minds. So the supports included for crisis services in the American Rescue Plan are really timely and significant. The Rescue Plan establishes the first ever incentive for states to expand mobile crisis services through Medicaid. States now have the option to provide community-based mobile crisis services with 85% federal matching funds for the first 3 years. And as you can see on this slide, the plan also allocates $15 million in planning grants to help states amend their Medicaid plans or use waiver requests to create community-based mobile crisis intervention services for people who are otherwise covered by the state's Medicaid plan. So mobile crisis intervention services are designed to serve people experiencing mental health, substance use crises. The services must be provided year-round, 24 hours a day, outside a hospital, jail, or prison facility. The services must also be provided by a multidisciplinary mobile crisis team, whose members are trained in trauma-informed care, de-escalation strategies, and harm reduction, and include at least one behavioral health care professional who is capable of conducting an assessment of the individual. These services must also be provided in a timely manner, offering people screening and assessment, stabilization and de-escalation, and referrals to health, social, and other services and supports. The providers of these services are required to maintain relationships with relevant community providers. The ability to use Medicaid to support these services presents a really exciting opportunity for states to help people in crisis who often end up cycling through jails, prisons, and hospital emergency rooms. It also is an unprecedented recognition on Congress's part of the value of using Medicaid to incentivize crisis intervention as part of a broader continuum of crisis and behavioral health services. As this group knows all too well, police and other first responders are called regularly to respond to people experiencing a mental health crisis or suffering from a drug overdose. In moments of crisis, individuals with these health conditions are more likely to interact with police than they are with medical professionals. and police encounters involving individuals with untreated mental illness are 16 times more likely to end in fatality. So law enforcement driven responses also drive over incarceration of people with mental illness. Nearly 2 million people with mental illness are booked into jails each year, and an estimated 64% of the people in local jails suffer from mental illness. And 1/4 of fatal officer related shootings are people who have mental illness. The decriminalization of mental illness is one of our top priorities here at Inseparable, and it's clear to see why. So as other speakers have mentioned, COVID-19 has amplified many of the gaps in our current systems and highlighted the need for expanded access to behavioral health services. Crisis call centers have experienced increased call volume since the beginning of the pandemic, and mental health providers are struggling to meet demand. So this is the backdrop of the crisis intervention provisions in the American Rescue Plan. Again, they're timely and critical. So with the new planning grants and Medicaid provisions paired with the expanded SAMHSA funding that the previous speaker spoke about, state and local governments and other stakeholders have more support than ever to attempt to scale alternative approaches to crisis services. So how do you access these funds? I think it's important to note that the mobile crisis incentive is available to both Medicaid expansion and non-expansion states. Of course, if you're in one of the 39 states, including DC, that have adopted Medicaid expansion, you can better cover and connect low-income people in crisis to a broader continuum of care. Groups running crisis intervention services on the ground should definitely reach out to their state Medicaid agency and governor's office and encourage a collaborative implementation effort that involves the full range of state agencies involved in crisis response and get engagement from people who are affected by the current criminal justice system and mental health systems. Groups should also be on the lookout for guidance from CMS on the implementation of this provision. Like John mentioned, we'll be sure to share it out through our coalition once it's issued. We'll also circulate a helpful report released last month by the National Association of Medicaid Directors with recommendations specifically for behavioral health. So examples of popular programs that would qualify for these funds include Cahoots, a popular program based in Eugene, Oregon that's often cited in crisis intervention conversations, but also Connections Health Solutions in Phoenix, Arizona, and Macro, the mobile assistance community responders of Oakland, based in Oakland, California. And finally, I'd be remiss if I didn't mention the rollout of 988, the new suicide prevention hotline. States across the country are introducing and passing legislation that sets parameters for implementation of this hotline, which starts in July 2022. It's a dedicated 3-digit number that will be available for those experiencing a mental health crisis, making it easier than ever for millions of Americans to access critical resources and life-saving help. The successful rollout of 988 offers what crisis intervention services are currently lacking: a sustainable and mandatory structure to plug into at the state level and pathways to sustain funding permanently. If we want to scale qualified non-police response for people in crisis, we have to make sure 988 works well and is funded sufficiently. And it's not just crisis call centers, but also essential wraparound services for everyone. It's an exciting time for everyone who, like a lot of people on this call, are reimagining crisis response. And John, I'll turn it back to you.
Thank you so much. So much rich content. Thanks to all the panelists, colleagues here who've done a really great job packing in such a short time. As I said, so we're not able, this structure, to answer questions. We will be issuing a report sometime next week, and I'll do our very best to answer all the questions that have come in through the chat. Abby, if actually you can go to the last slide to have my contact, please reach out. I'll do my very best to answer questions that I can answer. Again, this is probably a very dynamic situation, so we're also kind of learning a lot. So thank you so much. And now let me turn it over to my colleague, Shakira.
Hi, folks. So again, thank you so much. Thank you to our panelists. Like, I have some of my mentors are on this panel that I've learned a lot from over the years, and I tremendously appreciate their insight and their participation in this panel. So thank each and every one of you for sharing your passion, your commitment, your expertise in this area. I want to urge everyone who's watching to visit our website at the National Coalition for Shared Safety. Go to www.wesharesafety.us. Go down to the link I'm not, technology is like not my thing. It may not be a link. It may be like a little thing you click on. Go to get involved and sign up so that you can receive emails, information about upcoming Zoom opportunities. What we want to do is that we want to elevate this collective voice about building what shared safety looks like, what we all mean when we say shared safety, how to fund that, how to make that a priority across the nation. So I welcome you to join us as you have today. Feel free to share our website with others. Feel free to sign up and look out for, if you haven't already registered, make sure that you have for this particular session so that you're able to get all the materials. You can get the PowerPoint presentation. We're also going to incorporate some of your questions into the report that John Mackey referenced. So make sure that you're sharing your information with us so that we can get you the information that you need so that you too can also be part of this shared safety movement. Thank you. Thank you. Thank you. We appreciate you so much and have a beautiful day. We're so glad to have you as part of this movement of shared safety.
Thank you, everyone.
Thank you all.
Thank you.
Thank you.